Knock. Hello, my name is Micah, and I will be the student nurse today. And what we're going to be doing is getting your head-to-toe assessment. So do you mind verifying your name for me?
Jasmine Beard.
Oh, okay, thank you so much for that, Jasmine. So what we're going to do first is actually get your height and weight. We've already gotten your vital signs and everything. So if you just come with me over. And we do have to wait a moment for this to be done. And we're just waiting. Close up. So what we're going to do first is get your weight. So just take a step up here. Okay. Okay, so her weight is 122 pounds. And now what I'm going to do is take this. Okay, just look straight for me. Okay, so you are 5'7". So now just step back for me. And now let's go back over here and finish the assessment. Okay, so I have assessed her height and her weight, and I got her vital signs. I've already introduced myself. I already said that this is the patient. So now what I'm going to do is the head-to-toe assessment. So she is obviously awake and alert. So could you tell me where you are?
USC lab.
And do you know what day of the year it is? You know the year?
2019.
Okay, perfect. So she's awake and alert, and her speech is appropriate and clear. Okay, Jasmine. So let me ask you. Actually, let me just note you are female or African American, and how old are you?
21.
21. Okay, perfect. Thank you for that. And now let me ask you, what is your opinion on health? On your health? Your opinion on your health is great. Okay. All right, so now, do you mind going to the restroom and emptying your bladder for me? Okay, thank you. Okay, so now what we're going to be doing is assessing your pupillary response. So if you could just look straight for me. Just going to check your pupils. Okay. One finger.
All right, so next will be accessing so I'm going to come around.
Perfect. The color of your eyes, so your sclera and your conjunctiva. So let's see. Okay, pink and white in both eyes. Perfect. Okay, so now what I'm going to be doing is just checking your scalp for any lice or lesions. I don't see any bugs or anything. I don't see any dandruff, so that's good. Okay, so what we're going to be doing is just checking your mouth to make sure it's moist, make sure your membranes are the right color, and to make sure there's no lesions. So just open up and say, no lesions. It is moist. And the color is perfect. Okay, so that's great. Okay, so now what I'm doing is just making sure that everything is symmetrical. So looks like your nose is in the middle, your eyes are symmetrical, your mouth, and your ears. So now what I'm going to be doing is looking for any drainage. Okay, there's no drainage in that ear. No drainage in this ear. Okay, so now what we're going to do is a whisper test. So if you would, just put your hand over one of your ears. And what I'm going to do is come behind you and whisper something. And you just tell me what that is.
Purple.
Okay, perfect. Now put your hand on the other ear.
And next I'm gonna move to
North.
Okay, perfect. So your hearing is great. Okay, so now what we're going to be doing is assessing your extremities. You are able to move your upper limbs. Okay, so now push against my hand. Okay, perfect. Now squeeze my fingers. Perfect. That's a great grip. And now pull against me. Okay, perfect. Now let me assess your nail bed just to make sure your capillary refill is good. If it is, this hand please. Okay, perfect. Okay, so now I'm just looking for any clubbing. It looks like you don't have any. So now let me assess your skin. Your skin is warm. It's not moist or dry, it's in the middle. Good. And there's no lesions. And now let me assess your skin. Perfect. That's great. Okay, so now what we're going to do is your skin perception. So just put your hands out like this for me and close your eyes. And I'm going to touch a part of your body and just tell me what I'm touching, okay? Okay.
Finger. Finger.
Okay, thank you. Okay, so now what I'm going to do is just assess your lung sound. So I'm going to assist you with turning around for me. So just turn this way, turn the other way. Okay. That's perfect. Now let's sit up. You can sit up. Okay, so let's see. So just take a deep breath for me. Another deep breath. Okay, perfect. So now I'm going to do on your side as well. So let's just turn back this way just a little bit. Okay, so breathe in. Breathe in. Breathe in. One more time. Okay, thank you for that. So now what we're going to do is do the same thing on your front. So just breathe in. Breathe in. Breathe in. Breathe in.
Don't go any
Okay, one more time. Okay, your lungs sound normal. Do you have any complaints of a cough or anything?
No cough.
Okay. Do you have any shortness of breath or anything? Assess your bowel sound. So I'm going to assist you with laying down. So that way I can do this. Okay. So the way that this is going to be in quadrants. So the belly button is the middle. So this is your right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. I'm just going to assess each, okay? Or oscitate each. Okay.
Alright, now I'm gonna do front part, and I'm gonna take you first to come get the
Alright. Have you experienced any drainage? Alright, now I'm gonna use this skin and tell me when you see it. Just look straight ahead and tell me when you see it, alright?
I'll cut it out. Alright. Oh, ready? Alright, so now I'm gonna listen.
Okay, so your bowel sounds are normal. So what I'm gonna do So right now what I'm doing is just feeling your bladder.
Edge of bed.
See if you have a bladder distension. You do not, so that's great. Okay, so now what I'm gonna do is just palpate. Do you feel any pain or anything during this? Okay, do you have any pain with using the restroom, urinating? Okay, when was your last bowel movement? Yesterday? Okay, that's pretty good. So your stomach is flat and it is pretty soft. So now are you able to move your legs independently? Oh, okay, so now what I'm gonna do is just look for your apical pulse.
Back in your clothes. Alright, so, we're gonna, we take the physical assessment. So, we schedule your appointment, your follow-up, and your correct days. Would you mind following me? Like, pause it. Just take a photo.
You also have to clean up the room.
Like, I need to clean up the room. Like, I need to record myself cleaning up the room.
Just when you say you burp, just burp.
Are you still recording? Alright, I've given her time to, alright, so,
Please put that in there.
alright, so I've given her time to change and get back into her clothes. I'm gonna go and escort her. I've given her time to change and get back into her regular clothes. Now I'm gonna go and help her walk back into her clothes. Alright.
Okay, so your apical pulse does sound great. And I don't feel any joint swelling. Do you have any tenderness in any of your joints? No tenderness? Okay. Okay, thank you so much for taking your shoes off for me. Do you mind if I remove your sock? You can? Okay. What we're going to do is just assess to see if there's any swelling or anything like that. And I'm going to test your capillary refill. So I don't see any lesions on this part of your skin, so that looks good. So what I'm going to first do is look for your pulse. Okay, perfect. So now let me check for your capillary refill. Okay. I'm just checking for edema, which is just swelling. Looks like you don't have any. These are pretty warm, so that's perfect. So do you mind, you can go ahead and put your sock back on. Your physical assessment does appear normal. So did you have any questions or anything for me? No? Okay, so what I would do is now make sure she has her call light, or if she's leaving, I would help her out of the room. Just make sure she's comfortable. If the bed rails were down, I would put them back up. And that would conclude a physical assessment.